Welcome to Emergency Insights. I'm James Carter. Today we're discussing the evolving role of dexmedetomidine in the management of acute pain and agitation, a topic of increasing relevance for healthcare providers in critical care settings. We recently encountered a compelling case that highlights the potential benefits of this agent. A 43-year-old female, admitted to the ICU with multiple rib fractures, presented with significant pain and agitation even after opioid analgesia. Her agitation was accompanied by concerning increases in blood pressure and heart rate. An infusion of dexmedetomidine was initiated at a rate of 0.3 micrograms per kilogram per hour. Remarkably, within 1 hour, the patient became calm and cooperative, maintaining spontaneous breathing. Her vital signs stabilized, without any significant bradycardia, and the infusion continued overnight, leading to sustained improvements in comfort and ventilation. This case exemplifies dexmedetomidine's efficacy. As many of you know, dexmedetomidine is a selective alpha-2 adrenergic agonist. Its mechanism of action involves the activation of alpha-2 receptors, which provides sedative, analgesic, and anxiolytic effects. The typical clinical dosing involves a loading dose of 1 microgram per kilogram, followed by a maintenance infusion ranging from 0.2 to 0.7 micrograms per kilogram per hour. In our patient's case, the initial infusion rate of 0.3 micrograms per kilogram per hour fell well within this recommended maintenance range, contributing to the rapid and positive response observed. This demonstrates dexmedetomidine's utility, particularly in situations where patients are refractory to conventional opioid analgesia. Beyond its use as an adjunct to general anesthesia and for sedation in the ICU, dexmedetomidine also plays a crucial role in pain control by reducing opioid requirements and has applications in addressing chronic pain. However, as with any potent pharmacological agent, careful monitoring is paramount. Common adverse effects include bradycardia, hypotension, dry mouth, and nausea. Vigilant monitoring of vital signs is absolutely essential throughout its administration to ensure patient safety and optimize outcomes. The case we discussed today underscores dexmedetomidine's valuable contribution to managing complex patients with acute pain and agitation in critical care. Understanding its mechanism, appropriate dosing, and potential side effects is crucial for all healthcare providers utilizing this medication. Thank you for joining me on Emergency Insights. I'm James Carter, and we'll continue to explore critical topics in healthcare.